If you are just joining us, we are just minutes away from learning the details of President Biden's new plan to slow the national surge in COVID cases.
And here to answer your questions about that and so much more, Dr. Todd Ellerin, of course, Chief of Infectious Diseases at South Shore Health. Doctor, we always appreciate your time and your knowledge. Let's talk about the situation that Biden's about to announce right now. Infection rates are very high, about 140,000 new cases every day. Vaccination rates are way down. Pandemic fatigue, that's way up. From a public health perspective, do you think that we're losing the battle here?
So, Maria, we're not going to lose the war, but are we losing the seasonal battle right now? I think so. There's 1,500 people dying a day in the U.S. That's way too much. Remember, we're fighting multiple synergistic epidemics. One is a virus with intense replicative prowess, okay? The other is mistrust in science and government. The third is pandemic fatigue, and the fourth is individualism. We're fighting a lot of things. And remember, currently right now, as you said, there's 150,000 cases a day, and we are in summer. In winter, we could have 4 times that amount. We could have over 500,000 cases a day. It is possible, if that occurs, that up to 5,000 people could die a day. So we need to change the course of this epidemic.
Dr. T, you've never been shy in sharing your thoughts, so let me ask you about this. You've been on the front lines of this pandemic since day one. Are you frustrated too?
So, Eddie, first of all, I'm super proud of all the physicians, nurses, respiratory therapists in my system. Over the past 550 days, we've taken care of over 2,500 COVID patients. One thing I want to point out, though, is every single day we have seen patients fighting for breath. And if you've ever been short of breath, you understand that there's nothing else you can think about. You can't think about your family, your loved ones, your children. All you're thinking about is that next breath. Right. And mostly this is in unvaccinated people, the vast majority. I would just please ask the unvaccinated Americans to consider the vaccine over the breathing tube. It is very safe, very effective, and it could save your life.
Dr. President Biden plans to toughen the vaccine mandate for federal workers and contractors, giving them just 75 days to comply. We expect other employers will change their policies soon as well. So, in your opinion, is there a medical reason why someone would need an exemption from one of those mandates?
So, Maria, there aren't many, but of course there are a few medical exemptions. If you've had a severe allergy to one of the COVID shots, if you've had a severe life-threatening reaction to one of the COVID shots, again, these are very, very rare, but if it happens, that could be a potential medical exemption. But the vast, overwhelming majority can take the COVID vaccine, and it is very safe.
So here we are, it's September 9th. We're close to the flu season, and so many people want to know, is it safe to get the flu shot and a COVID vaccine at the same time?
Right. I'm glad you mentioned that, Eddie, because remember, we're talking about, and you've heard people use the term twindemics. We're concerned that because flu was so mild last year, there may be a much, much greater amount of influenza this season. So we don't want that combination of flu and COVID-19. And the answer to your question is yes, you can get the COVID vaccine and the flu shot at the same time. We just inject in different arms. It's very safe and no issues there.
Dr. Ellerin, thanks for your time.
Take care, guys.
Thank